Hi, I'm Gemma. I'm the marketing manager here at Church Road Dental and Cosmetics. This is the first in a series of informative videos that we're going to be producing on treatments that we offer here at the practice. And we're going to start today with dental veneers because they're one of our most popular cosmetic treatments at the moment. And dental veneers are a really good solution to misshapen or imperfect teeth. They're thin tooth-coloured shells that are bonded to the front of the teeth to create a straighter appearance, and they're a really quick and effective solution to crooked, misshapen or imperfect teeth, and they can alter the size, length, shape and colour as well. And what we'll do today now is address some of the commonly asked questions that we get here at the practice on dental veneers. Okay, one of the most common questions that we get asked are, will veneers damage my teeth? So there's two main types of veneers, porcelain and composite. Now in most cases, when you have porcelain veneers fitted, this does require some reshaping of your natural teeth using a drill before the veneer can actually be fitted on top. And this is an irreversible process, so it will leave some damage to your natural teeth. Now, if the treatment's done correctly, the drilling should be minimal. You should never be left with like stumps that you sometimes might have seen horror stories in the media. You can get minimal or no prep porcelain veneers, but your teeth need to be fairly straight to start with and require minimal adjustments. So in the majority of cases with porcelain veneers, there is slight damage to your natural teeth. However, with composite veneers, the majority of cases there's no damage at all to the teeth. The composite resin, it's a similar kind of material to what dentists use for a white filling. It's shaped around your own tooth by the dentist without the need for any drilling. In rare cases, we may need to make minor adjustments to your natural teeth, but most of the time, the resin can just be moulded around your tooth that is there. Another question that patients will commonly ask and like to know the answer to is how much veneers cost. Now here at the practice, a composite veneer will be between about £250 to £300 per tooth. And yet for a porcelain veneer, the starting cost per tooth is £750. So the composite veneers are a much more affordable option for patients because the dentist actually moulds the shape of the veneer whilst the patient is sitting in the chair. But with a porcelain veneer, they have to be sent away for the dental laboratory to make them, so it makes them more expensive. So with both cases, the composite veneer is a much more affordable option. Okay, patients commonly also ask how long do veneers last. Porcelain veneers are really durable and can last for many years, usually around 10 to 15, if you take good care of them using a good oral hygiene home care routine. Now I've got porcelain veneers here. These were done here at the practice by Shy over 10 years ago, and I haven't had any problems with them yet, touch wood. So they are really long lasting and they're really reliable as well. I've never had any chips or breaks or anything like that. Now composite veneers generally don't last as long. You should get between about 4 and 8 years out of a composite veneer without it breaking or needing replacing, so they don't last as long as porcelain. We often usually get asked as well whether veneers are resistant to staining. Now porcelain veneers will resist everyday staining from things like tea, coffee, red wine, other dark or richly coloured liquids or spices, but composite veneers can discolour and stain over time, although with modern materials this is minimal. But when looking at the two options, porcelain veneers will resist staining much better than composites. So patients that are considering this treatment will often ask if the veneers will damage easily. So as I said before, porcelain is a lot more hard-wearing and durable than composite. So with those types of veneers, you are going to have less damage and less likelihood of breaking. So therefore, composite veneers will need to be refreshed or replaced more frequently. With either option though, you need to look after the veneers in order to reduce the likelihood of damage, and therefore you should avoid putting too much pressure on them. Now, Now, once you've had this treatment, it's important to know whether veneers are expensive to replace or repair. Now, if a composite veneer breaks or chips, it's much cheaper to repair than a porcelain veneer. This is because it can be repaired by your dentist in one visit, whereas porcelain veneers can't be repaired. If they break, they must be replaced, a brand new one must be made at the dental laboratory and then sent back for you to have fitted here at the practice. Another thing people like to know is how many appointments they'll need for the treatment. Now, for composite veneers, the whole treatment can usually be completed in one visit, whereas with porcelain, it's going to take between 2 to 3 visits. Also with the porcelain veneers, you'll need to wear temporaries whilst your real veneers are getting made at the dental laboratory. And with both treatments, you'll also require an initial planning appointment beforehand where the digital smile design will take place. Okay, lots of people ask us whether they're actually going to be suitable candidates for veneers. Now, your dentist will examine your teeth at the initial consultation and must conclude that your teeth are strong and healthy before starting the treatment. They'll also need to be satisfied that there's a really good level of oral hygiene in place. Tooth decay, gum disease, evidence of grinding are all things which may make treatment less viable, and this is the case with both composite and porcelain options. Okay, so we can see that there are pros and cons for each type of veneer, but what people generally really want to know is which are going to give the best results. Porcelain veneers every day will create a much more lifelike and natural tooth appearance than composites. Basically, the porcelain has translucent properties, and this kind of allows the veneers to mimic the light handling characteristics of the enamel, so it gives it that depth that a natural tooth will have, and it will just look a lot more natural than a composite, and therefore they are the ones that are able to create a more realistic and natural smile. Finally, if dental veneers aren't an option for people, they often ask what the alternative treatments are in order to create that perfect smile. So if you or your dentist do decide that they aren't the right option for you, then there's lots of other procedures, for example crowns, bridges, implants or orthodontic treatments that can all help you to achieve that perfect smile. Now, we offer all of those here at the practice, so please feel free to get in touch if you'd like any further information on any of those. And we'll also be producing some more informative videos about those treatments, so look out for those as well on here. And yeah, so thanks for watching, and I'll see you next time when we answer some common questions about dental implants.